Hey guys, it's Dr. Childs here, and today I want to talk about progesterone, and I want to talk about progesterone in the setting of your weight. We're going to be focusing on this question: does progesterone cause weight gain or weight loss? And in order to answer this question, we need to dive a little bit deeper into what progesterone actually is. Now, I think the best way to think about this is to not think about progesterone in isolation or to think about progesterone by itself, but to group together estrogen and progesterone. So in the female body, well, and men do have progesterone as well, but we're not talking about men right now. We're going to be focusing on women. But in the female body, progesterone and estrogen, along with testosterone, are considered the sex hormones. And we'll just ignore testosterone for now and focus just on progesterone and estrogen. And you can think of these two hormones as opposites to one another. So, for instance, estrogen is more of a growth hormone. And what I mean by that is that you can think of estrogen as a hormone that makes everything bigger, especially in a woman. Now, this would include things like the endometrial lining within the uterus. This would include things like breast tissue, so that it causes the enlargement of the breasts. It also is one of the reasons that estrogen is felt to lead, if in high amounts, is felt to lead or confers an increased risk for developing breast cancer. So it makes the uterine tissue grow, it makes the breast tissue grow, the glandular tissue in the breast. It also makes your fat cells grow. Okay, so pretty much anything it comes into contact with, estrogen is going to make it grow. So what does progesterone do? Progesterone you can think of doing the exact opposite. So while estrogen is the growth hormone, you can consider progesterone the antidote to that. So instead of making the breast tissue larger, it helps reduce it. Instead of making the uterine lining grow, it helps reduce it. Instead of making your fat cells grow, it antagonizes the effects of estrogen and therefore can help some patients with weight loss. So this is sort of the approach that many patients take. So they think to themselves, well, if progesterone is an antagonist to estrogen, if I just take progesterone, won't that lead to weight loss? And the answer to that is no. Okay, and so that's why we have to discuss this. Now, you want to think about this. You want to think about estrogen and progesterone in terms of ratios to one another. So what's important is not necessarily the absolute value of your estrogen or the absolute value of your progesterone. What's more important is that balance between those two. Okay, and what I mean by that is if you take 100 women and you lined them up and you looked at their hormones, you would see different levels for all of them. And I'm talking healthy women. 100 healthy women, you just line them up and you checked all their hormones, even if they were at the same time of the month, every single one of those women would have different hormone levels. Okay, and what you would also notice is that these women, some would have larger breasts than other ones. Some would have fat on different places of their bodies. They would have different physiques. They would have more muscle mass. Some would have less. All of these things would be different among these healthy women. And one of the key players in the physique of a woman is progesterone, but also estrogen and testosterone. And it's the relative combination and concentrations of these hormones that interact with one another to create the physique that you see in most women. Now, there are other factors involved, but that's the easiest way to think about it. So let's, again, eliminate testosterone from this discussion for a moment and talk just about progesterone and estrogen. Now, as you probably know or may know, most women in the United States tend to have too little progesterone. And they also tend to have too much estrogen. So you can see that that ratio is automatically skewed. But what can also happen is that a woman may have too much estrogen, but they may have just normal progesterone levels. And so a woman may see that she has all of the signs of excess estrogen and think to herself that she needs to supplement progesterone. And some of the women who do this may actually get more than they bargained for with weight gain as a result of taking that progesterone. And that's not what we want. We'll talk about who should take progesterone in just a moment, but let me talk about the symptoms of having excess estrogen in your body so that you know what we're talking about. So there are several sort of symptoms and conditions and disease states that tend to accompany high estrogen levels, and let's go over those for just a moment here. So first of all, endometriosis. That's one of those conditions that tends to accompany high levels of estrogen. Another one is fibrocystic breast disease. Any history of PMS or PMDD. Any issues surrounding your cycle, any mood disorder surrounding your cycle, migraines surrounding your cycle, intense pain, any of those things that tend to be around your cycle, which would imply that your hormones are affecting other areas in your body. Right, so it's kind of intuitive. So if you have weight gain around your cycle, if you have migraines around your cycle, if you have mood changes around your cycle, if you have hormones around your cycle, etc., that's an indication to you, an early indication, that something is wrong with the ratio of those hormones. Okay, and another one would be breast tenderness, heavy menstrual cycles, mood swings, etc. So any of these symptoms would indicate that you have too much estrogen, but it doesn't necessarily mean that you need to take progesterone, and that's what we need to kind of discuss. And that's how it kind of relates to who should take progesterone, right? That concentration of estrogen. We won't talk about the symptoms of excess progesterone in your body, but that is one of the main reasons that women do gain weight. So when they take progesterone. So let's talk about that for just a second. How you take progesterone, if you do decide that you need it, and we will talk about that in just a moment, there are a couple things you need to consider. Now, what will happen traditionally is a woman may start taking progesterone because she heard somebody else took progesterone and lost a bunch of weight, or felt, there's a huge difference, whatever. It doesn't matter. But sometimes those women tend to gain weight and have a paradoxical reaction even when they have those symptoms that we listed above. And so that could be due to several reasons. So there's a couple things you want to realize when and if you decide to take progesterone. Number one, you generally want to use a bioidentical, well, first of all, you want to use bioidentical, meaning you want to use progesterone. You do not want to use a synthetic version of progesterone. Okay, so you have two kind of categories here. The pharmaceutical companies, and these are the things that include most hormone replacement therapies that come from a conventional physician, and most oral contraceptives, they fall into the synthetic category. And the synthetic progesterones, but they're called progestins and progestogens, you want to avoid those because they are not bioidentical to the body, meaning your body doesn't necessarily know, it knows how to get rid of them, but there are a lot of byproducts as a result of the metabolism of these medications, and that is what can cause the issues related to these medications. So first of all, if you're going to use progesterone, make sure that it is bioidentical, and that will be labeled as something like progesterone USP. Okay, so that's how you know the active ingredient is a bioidentical progesterone. So that's number one, make sure it's bioidentical. Number two is, generally you want to be using you want to get the progesterone into your body, and you want to make sure that you bypass the intestinal tract. So what that means is you want to be, you want to preferably apply it transdermally, meaning through the skin. That can also be through other mucosal membranes in your body, such as vaginal mucosa or some other area there. But the point is, you want to avoid the first pass metabolism in the liver. Okay, and that first pass metabolism occurs if you take anything by mouth. So if you take it by mouth, the progesterone, and you can take progesterone by mouth, which we'll talk about, but let's say you do take it by mouth, it's going to go through your GI tract, it's going to get absorbed into the venous system of your body inside your gut, it's going to go through the portal vein right up to your liver, and your liver is going to metabolize it right away, and it's going to create byproducts, which is not the normal way that this happens in your body. So now you can compare that to taking something through the skin, and what happens is the progesterone is absorbed through the skin. It's taken in the venous system, but instead of going to the liver first, it goes to your heart, which then gets pumped out through the arterial system. So in that method, it goes to the tissues first, and then it circulates through the liver. So what that means is that you get a higher concentration of the actual hormone to the tissues first before metabolizing it like you would if you took it orally, meaning by your mouth or through the GI tract. So that's point number two. You want to take it transdermally if possible. But then another option is, some people can take oral progesterone as long as it is actually the bioidentical form. But now how you do this actually matters. So what can happen is, let's say somebody does need progesterone. They've determined that their progesterone level is low, so they try to take it, but instead of taking the bioidentical form, they may take a synthetic form. Okay, well that's probably going to cause weight gain all by itself, and there's studies to show that, and I link them in here. So that would be like one of the mistakes you make. The second mistake would be you don't use it in a way, you may need, let's say instead of taking synthetic, you decided to take a bioidentical oral form. Well, that may also cause weight gain in certain individuals. So a better option would be to use the transdermal route. And then finally, another mistake that people make is that they may take it just constantly, when like every single day or 28 days per month, when that's not how it occurs in your body normally. So progesterone tends to peak in the luteal phase, which is days 14 through 27 of that traditional 28-day cycle. So that's when you would want to take it. So if you were a menstruating woman, you would want to avoid it for the first 14 days, but you would want to consider taking it for those last 14 days, assuming again that you are low. So let me just recap these. So if you want to take it correctly, there's kind of 4 steps that you want to make sure that you are following. First, you want to make sure that you bypass the first pass metabolism, which means, if possible, using transdermal route. You want to make sure that you are taking progesterone when it would naturally and normally be high during your menstrual cycle, which is the last 2 weeks of the cycle or during the luteal phase. You want to make sure that you avoid synthetic formulations of progesterone and use only bioidentical forms. And lastly, you want to make sure you are only taking enough progesterone for your body, okay? Because any excess will cause weight gain. So the question now becomes, who should actually use progesterone to get this benefit of weight loss that we're talking about? So now that you know who shouldn't take it, let's talk about who should. So first of all, and this should go without saying, patients who have low serum progesterone levels should obviously be the ones to use that. Now I've included this graph here because something interesting tends to happen around age 35 or so in most women, most ovulating women. These women have, over time, even in their 30s, they have a drop in estrogen, but they also have a drop in progesterone. Now what's interesting here is that the drop in progesterone tends to be more dramatic relative to the drop in estrogen. And this results in that sort of estrogen dominance type phase that we talked about before. And this can occur just naturally in a lot of women. So you want to make sure that you test these levels and test the ratio between your two, or test the ratio between both estrogen and progesterone in your body. Number 2, women that should use progesterone here. Any woman, pretty much any woman, I won't say any because that's not entirely true, but most women that are menopausal will probably benefit tremendously from using progesterone cream. And the reason I say that is because the main source of progesterone in a woman is ovulation through her menstrual cycle. So if a woman is no longer ovulating, which is the definition of menopause, then you can safely assume that her progesterone level is likely very low. There are some weird conditions that can cause higher levels, but under normal circumstances, a postmenopausal woman will have very, very low levels of progesterone. The next category is women with estrogen dominance should also consider it. So we talked about all those, but this would include women who have any of the following of these symptoms or these conditions: PCOS, or even being on the PCOS spectrum, insulin resistance, diabetes, either type 1 or type 2, or if you've been told that you have issues with blood sugar. Any woman with hypothyroidism, because low levels of thyroid hormone will affect progesterone, and generally hypothyroidism conventionally isn't treated as well as it can be, and so usually women tend to be undertreated and therefore have low progesterone as a result of that. Any woman with obesity or weight gain from any cause. Why? Because extra fat in the body allows for aromatization of androgens, which increases estrogen. Okay, that's why that one's there. Anyone who has a history of eating disorders, binge eating, or emotional eating. Anyone with high stress or a history of adrenal problems. Again, all these things are kind of linked together. And then lastly, any exposure to xenoestrogens or endocrine disrupting chemicals. And these are chemicals that kind of confuse your body. So what they do is they look like estrogen, or they have subgroups that are similar to what estrogen has, and these xenoestrogens or chemicals can attach to estrogen receptors in the body and start to stimulate the same effect that estrogen has, without that actually being caused by estrogen itself. So that's definitely an issue. And those things, certain individuals tend to be better about eliminating the xenoestrogens and EDCs, which stands for endocrine disrupting chemicals. Some individuals are better at getting rid of these things than others. So in some of you this may be a problem, and in others it might not be an issue. That depends a lot on your environment and your genetics. Lastly, well, actually this isn't lastly, this is number 4. Women with hypothyroidism should consider using progesterone cream. And again, that has to do with the fact that the thyroid hormone helps to first of all regulate ovulation, right? Which is one of the reasons that hypothyroid patients, if they're not treated, tend to suffer from infertility. But also that there is a link directly between progesterone and thyroid hormone itself. So aside from the ovulatory factor, there's also a direct relationship with progesterone. So if you are hypothyroid, you should absolutely get it checked out. And then I believe this one is the last one, and this one is any woman with severe fatigue or adrenal fatigue. And the reason for that is cortisol also affects progesterone levels. And so if you have actually low and high cortisol can actually alter your progesterone levels in different ways. But if you have extreme fatigue, or you fit into that category of adrenal fatigue, then it's worth evaluating your serum levels of both progesterone and estrogen. Okay, so how do you actually use it? I'll talk about the cream here because I think that's the most that's probably the most helpful. And what you want to do is you want to, now this is general, so this isn't specific to any one person. Now realize everybody's a little bit different, but if we took the majority of patients and we treated them a certain way, this would work for a lot of people. It wouldn't work for everyone, but it would work for a lot of people. So if you are a menstruating woman, meaning you're having your cycle, you would want to use around 20 to 40 milligrams on days 14 through 28 of your cycle. That's the latter half of the month. That's the luteal phase, etc. We've talked about that in the past, but that's the way that you would want to do it. You would want to make sure that you alternate the locations with which on your body where you put progesterone, because you can develop something called dermal fatigue. But essentially, you would use it those last 28 days, or the last days 14 through 28 of your cycle. Now, if you're menopause, you can use, dose may be a little bit different, but again, we'll just standardize this by saying 20 to 40 milligrams per day. And there's 2 ways you can do this. You can either do this 6 days per week and take a day off, so you do 6 days on and then 1 day off, or which I usually prefer to do is do it for 26 to 28 days straight of the month, and then take the last several days off of the month, because you want to try and mimic some cycle, not the exact cycle, but you want to break from it to allow so you don't get saturation of the fat cells or develop this dermal fatigue. Now you can get, now this is the interesting thing, you can get bioidentical progesterone cream over the counter. It is not a prescription medication if you buy the cream. However, if you fail the cream for whatever reason, then you may need to switch to oral progesterone. And oral progesterone is a prescription medication, so that means you will need to get that one from your doctor. And one of the potential downsides of using, we'll just do this real quick, but one of the potential downsides to using progesterone is that progesterone, if you take it orally, like Prometrium is the drug name, but if you take Prometrium orally, you get very high levels of a progesterone metabolite known as pregnadiol. And we're not really sure if that's a bad thing long term or not. Since we're not really sure, my recommendation is to avoid it if at all possible. Now, some patients do benefit and they do better on oral progesterone, and if I have a couple, and if that's the case for you, then that's just the case, and that's what you should probably do. The best thing you can do, though, is to find a physician who's willing to work with you, who can help guide you through these things that we've talked about, because it's not common that somebody jumps into progesterone and gets their dose right off the bat and it works perfectly. So you want to make sure that you go through these things, use it only when necessary, and if you use it in those, I think it was 5 cases that I recommended, then there's a good chance that it will assist you with weight loss. It's not going to be a magical weight loss medication, but it may actually help if it's part of a comprehensive treatment plan. So that was the end of this. If you guys have any questions, feel free to leave them below. Otherwise, I hope you guys found this informative and educational. I'll talk to you guys soon.